Welcome to the Dermatology Studio with Dr. Yusra Ayaz.
You know, when you hear the word eczema, you probably picture one specific kind of itchy red rash. But what if I told you that's just the tip of the iceberg? Eczema is actually a whole family of skin conditions, and some of its members are, well, they're pretty unusual. Today, we're going to meet some of the most fascinating ones. So let's start with a question that kind of turns what we think we know about eczema on its head. We all know a rash can get infected, right? That makes sense. But what if the infection came first? What if the microbes themselves are the ones pulling the strings and causing the eczema to appear? That's the rabbit hole we're about to go down. All right, here's our roadmap for this explainer. First, we'll get into infective eczema. Then we're going to unravel a really strange allergic reaction called dermatophytide. After that, we'll look at what happens when eczema forms these weird halos around things like moles. And we'll wrap it all up with the key things you need to know. Let's do it.
Okay, first up, infective eczema. As the name suggests, this is all about your skin having a direct inflammatory reaction to tiny little invaders.
This is the absolute key point to get. We are not talking about a standard case of eczema that, oops, got a secondary infection. No. With infective eczema, the microorganisms are the instigators. They are the root cause, the ones that actually start the reaction.
So what does this look like under a microscope? Well, pathologists have a 5-point checklist. They're looking for signs like spongiosis, which is basically the skin getting waterlogged and spongy. They also see different types of skin thickening, and they can literally spot the immune cells rushing to the area to fight. It's like forensic science, but for your skin.
Infective. Okay, it sounds like we're splitting hairs with grammar here, but in dermatology, this difference is massive. Infected eczema means an existing rash got a bug. Infective eczema means a bug caused the rash. Let's really dig into what sets them apart.
Think of this as your field guide for telling these two apart. See how infective eczema is described with words like exudation and crusting, that weepy, oozy look? Infective eczema, on the other hand, is more about redness with tiny blisters. And look at where you find it. It often hangs out near existing wounds or ulcers. These little details are everything when it comes to getting the right diagnosis.
All right, let's look at a specific example. You know that damp, stuffy environment that happens when your feet have been in heavy shoes all day? Well, that is the perfect breeding ground for this guy, infective dermatitis of the forefeet. It especially loves the spaces between the toes.
So what's the story here? It's pretty straightforward. Common bacteria, like staph and strep, find a nice, warm, damp home, say between your toes, thanks to sweaty feet and tight shoes. They set up camp, start to multiply, and boom, you've got infective dermatitis. The good news is that it usually clears up pretty well with the right antibiotic treatment.
So how do you treat this? It's a 3-tiered approach. First line of defense, get to the source. That means treating any ulcers or wounds that are providing a home for the microbes. And for the foot version, changing up your footwear is a must. If that's not enough, you move to the second line, topical antibiotics. And for really stubborn cases, the third line involves systemic antibiotics and maybe even antiseptic soaks.
Okay, so we've talked about germs directly causing a rash, but now let's get weird. What if the infection is somewhere else entirely, like on your feet, but the rash shows up on your hands? Welcome to the very strange world of dermatophytide.
This is so wild. Picture this. You have athlete's foot, which is a fungal infection. Then, all of a sudden, you develop an eczematous rash on your fingers. The two seem totally unrelated, but they're not. The rash on your hands is actually an allergic reaction to the fungus on your feet. It's your immune system overreacting. And here's the kicker. The hand rash itself has no fungus in it. You treat the foot fungus, and the hand rash just goes away.
And to make things even trickier, dermatophytitis is a master of disguise. It can look like all sorts of different skin conditions. It might be little blisters on the fingers, or it could mimic other rashes entirely. It's a true chameleon of the dermatology world, which can make it a real puzzle to diagnose.
So we've covered infections, and we've covered allergies. But what if the trigger for the eczema is something that's been on your skin for years, like a common mole? Next up, we're looking at cases where eczema forms a halo around other skin growths.
First in this category is Halo Dermatitis. It's exactly what it sounds like. For some reason, the immune system decides to target a common mole and creates this perfect ring of eczema right around it.
And take a look at this. You can see it so clearly. There's the mole right in the center, and then this perfectly circular, inflamed ring of eczema surrounding it. It's a pretty striking thing to see.
So what's the deal with these halos? Well, they can be quite itchy. And if you look under a microscope, you can see the immune cells gathering around the mole. But here's the really interesting part. Most of the time, after a few months, the halo just fades away on its own. And the mole in the middle? Totally fine. It's like the immune system was just temporarily confused.
Now, meet the myrisine navis. It's basically the cousin of Halo Dermatitis. It's the same idea, an eczematous halo, but this time the central lesion isn't a mole. It's a seborrheic keratosis, which are those common waxy kind of stuck-on looking growths that many people get.
And for our last one in this group, we have a bit of a plot twist. This one is called Murray-Williams warts. Here, the eczema doesn't form around a growth. Instead, a whole bunch of these seborrheic keratoses pop up in an area after a patch of eczema has already healed and gone away.
And this is what that can look like. You can see this whole smattering of little growths across the skin, almost like they grew in the footprint of the eczema that was there before them.
So what happens to these conditions over time? The good news is they both tend to resolve on their own. Halo dermatitis is usually the quicker one to go, disappearing within a few months. Murray-Williams warts tend to stick around a bit longer, gradually fading over about 5 or 6 months. All right, we have covered a ton of fascinating and, frankly, strange skin reactions. So let's bring it all together and make sure we lock in the most important points from all of this.
If you remember nothing else, remember these 3 things. 1. For infective eczema, the cause is the microbe, so the treatment is to go after that infection. 2. For dermatophytide, it's an allergic reaction to a fungus somewhere else, so you have to find and treat that fungus. And 3. For those halo reactions, the cause is an immune response to a growth, and the best treatment is often just patience.
So, what does this all tell us? I think it shows that our skin is way more than just a barrier. It's a dynamic, incredibly complex organ that's in constant communication with our immune system. These unusual types of eczema are just a glimpse into that intricate conversation, a reminder of how our bodies can react in ways we'd never expect. It really makes you wonder, what other incredible things is our skin doing that we don't even know about?
Thanks for watching. Hit like, share, and subscribe to the Dermatology Studio. Ask your skin queries in the comments below.